Good morning, everyone. It's time for a Henry County Health Center FYI. And this morning, joining me over the phone, we have Katie Westfall, who's the Diabetes Program Coordinator, and Natalie Gent, who's the dietitian at the Henry County Health Center. Good morning.
Good morning.
Good morning.
Well, I know that November is National Diabetes Month, and I can't believe here we are in November already. So let's sit down and talk about your guys' diabetes program. I guess first, what is type 2 diabetes and how do you get diagnosed?
Yeah, so type 2 diabetes, that's when your pancreas is not making enough insulin or you have insulin resistance present.
Okay, so how do you get diagnosed?
So diagnosis, usually you'll have a fasting a fasting blood sugar or an A1C. And an A1C is a 3-month average of your blood sugars, and the number you will see is a percentage. And diagnosis can either go off that percent or it can go off just a fasting blood sugar as well.
So what are the common signs and symptoms of type 2 diabetes?
So some common symptoms would be increased thirst, increased urination, increased hunger, unintended weight loss, fatigue, blurred vision, frequent infections, slow healing sores, numbness, tingling in hands and feet. So there's a lot of different ones. And of course, you can probably tell a lot of those could be a lot of other things going on too. So it's best if you're having any of these symptoms to go visit your doctor and see if they can rule out diabetes at least.
Yeah, I was just thinking that. I'm like, wow, some of these symptoms could be, really common for other things too. So I think you're right to say it's always best to go to the doctor if you have any doubts whatsoever. Because I know too, based on previous conversations with both of you, that diabetes can go undiagnosed in a lot of people.
Yeah, that's pretty common actually.
So let's talk about how you two work together to provide that education for patients who have type 2 diabetes.
Yeah, so with the nurse and the dietitian here in our center, we really like to provide patients with the whole picture regarding their new diagnosis of diabetes. So we really just start with the general information, informing them about what is diabetes and everything on that side. We go into medications, where we like to see the blood sugar targets, and we talk about physical activity and nutrition, of course. We just really like to individualize every education for each patient that we get.
So let's talk then about some of those frequently asked questions, because it is individual to everyone, but we all kind of have the same type of questions when it comes to type 2 diabetes. So the first one I hear a lot of people ask is, can type 2 diabetes go away if my blood sugars become normal?
Right. So there is technically no cure for type 2 diabetes, but there are things you can do, like sometimes weight loss, eating well, exercising regularly, that will make your blood sugars return to normal, but there is no cure for type 2 diabetes.
So do I need to monitor my blood sugar then if I have type 2 diabetes?
Yeah, so this is another frequent question we get, and I would say it really depends on what your provider or maybe diabetes team wants you to do. Everybody's individualized with this. So some people may test multiple times a day and some people may not test at all. It really just depends on what your individual plan is.
So if I start taking medication, because I've heard this one too before, if I start taking the medication or the insulin for my type 2 diabetes, I'll have to take it forever. Is that a common question?
It is. And I tell people that no, not necessarily. A lot of times, especially if your blood sugars are really high at first, you may be started on insulin or more than one medication even, and those can be decreased or even discontinued over time if your blood sugars start to come down with other interventions as well.
Do people with diabetes need to avoid carbs?
This is a really big common misconception with diabetes, especially when people are first diagnosed. So you are still able to include carbohydrates in your diet. It is just important to be building those balanced meals. So making sure there is a source of carbohydrate, but also some protein and some fiber with that meal. That will just help with the digestion of the carbohydrates to not spike our blood sugar so much. So an example of what that might look like is having a chicken breast with asparagus and then mashed potatoes, and the potatoes would be the carbohydrate choice.
So let's talk about sugar, because we know that sugar levels in the blood is what diabetes is. So does eating sugar cause diabetes?
That is a common question that we get asked too. So no, sugar is not directly causing the type 2 diabetes. So it's important to look at the biggest risk factors as far as developing type 2 diabetes. That is being overweight or obese, being over 35 in age, a family history that has a strong correlation, having prediabetes or a history of gestational diabetes. So although sugar does not directly cause diabetes, it is important to just, again, going back to that balanced diet.
Well, it sounds like maybe eating healthy might be one of those ways to kind of keep track of these things. What are ways that people can prevent type 2 diabetes?
Sure. So the best ways to prevent the type 2 diabetes, again, are eating a balanced diet, making sure we're getting lots of fiber, and then having regular physical activity. So the recommendation for that is 150 minutes a week. So the combination of the two can really help with preventing type 2 diabetes and just living a healthy lifestyle.
Well, I know sometimes when, all of us know someone with type 2 diabetes, but when we get the diagnosis ourselves, our head starts spinning with all of these questions and how do I do balanced meals and all of these things. So can you guys talk about the Henry County Health Center's Diabetes Education Center and the services that you offer to help people with this stuff?
Yeah, so we are here for all things diabetes. We do offer a monthly group diabetes class, and that is typically for those that are newly diagnosed. And then we also have a monthly review course. That's just a good refresher to kind of go over the target blood sugars again, go over any nutrition and exercise questions. And then we have support groups that we kind of pick a topic and dive deeper into diabetes. So those are offered monthly as well. So we have a variety of offerings to help people educate themselves on living with type 2 diabetes and trying to live that healthy lifestyle as well.
If people have questions on the diabetes education services at the health center, how can they get a hold of you?
Yeah, we would be happy to help anyone with any questions regarding their diabetes, and they can just reach us at 385-6518.
Fantastic. Is there anything else, Katie Westfall, the diabetes program coordinator, and Natalie Gent, the dietitian at the Henry County Health Center, that you ladies wanted to mention while we're talking about diabetes and Diabetes Month in November?
I don't think so. I think our main focus today was just really going over those frequently asked questions we get a lot, because a lot of them have misconceptions and things involved with them. So the purpose of this month is to bring awareness to the disease, and so I think that's about it from our end.
Fantastic. Well, appreciate you coming on this morning to talk about the Diabetes Education Center at the Henry County Health Center. You guys have a great National Diabetes Month.
Thanks, Katie.
Thank you.